today's topic: ovarian cancer in young women.
Ovarian cancer does occur in young women, yet there are several ways it differs from older women.
Younger women and older women.
Although epithelial ovarian cancer is infrequent in women under 40 years of age, it can and does occur in young women.
When found in a woman's 40s, or before she reaches them, it is more often related to hereditary factors and BRCA1 or BRCA2, genes that greatly increase one's risk of both ovarian and breast cancer.
Even at earlier ages, especially when there is a family history of these cancers, paying attention to persistent abdominal and pelvic symptoms is important.
Common types of ovarian cancer in young women.
Ovarian cancer is actually a spectrum of diseases, and there are more than 30 known subtypes.
Each type can behave differently and respond differently to treatment plans.
There are two major categories of ovarian cancer that occur mainly in younger women: germ cell and sex cord stromal tumors.
Here is a brief overview of each. Germ cell tumors.
These cancers arise from the cells in the ovary that are meant to become eggs and are rare, representing only 5% of all ovarian cancers. Around 70% of these tumors are diagnosed early, but they tend to be fast-growing tumors.
These tumors are most commonly found in women in their early 20s.
The main subtypes in this category include
Dysgerminomas,
Endodermal sinus tumors,
immature teratomas,
tumor markers. These cancers often produce tumor markers, LDH, AFP and HCG, that are measurable in the blood.
These are essentially clues that may help physicians determine, even before surgery, what the likely subtype is.
If you recognize HCG, it is because it is the hormone that's tested for in pregnancy tests. Since these tumors may secrete this hormone, and since one of the symptoms of ovarian cancer is abdominal distension, these tumors are at first sometimes misdiagnosed as pregnancy.
treatments. Surgery is required to determine the exact subtype and see if the cancer has spread.
Many women are concerned that choosing surgery as a treatment option will affect their fertility.
In many cases, however, only one ovary needs to be removed, so fertility is often, though not always, able to be spared.
In this case, the other ovary, fallopian tube, and the uterus are left in place, and pregnancy can usually occur normally.
They tend to be very sensitive to chemotherapy and therefore are often curable, especially when found in early stages. The treatment for immature teratoma is more complex than for the other germ cell tumors.
Sex cord stromal tumors.
These cancers begin in the connective tissue cells that essentially hold the ovaries together and produce hormones such as estrogen, progesterone, and testosterone.
They represent about 6% of all ovarian cancers and mainly occur in young women.
In general, they tend to be slow-growing tumors.
The main subtypes are
Granulosa stromal cell,
sertoli Leydig tumors,
Granulosa stromal cell tumors may produce a hormone called inhibin, which can be used as a tumor marker. Diagnosis is usually made in an early stage of the disease, and the adult form, usually found in patients over age 40, is usually not very aggressive.
However, the so-called juvenile form, most but not all cases arise in the first 20 years of life, is more often found in advanced stages.
Unfortunately, it is not very responsive to chemotherapy.
Malignant, cancerous, sertoli and sertoli Leydig cell tumors are quite rare.
Most are either benign or non-aggressive cancers.
The vast majority are found in early stages and are very curable with surgery alone.
Since they produce either estrogen or testosterone, early symptoms usually have something to do with hormonal changes.
These symptoms may include facial hair growth, low voice, and early puberty and/or abnormal periods.
Genetics and hereditary ovarian cancer.
As noted above, genetics plays an important role for some women who develop ovarian cancer at a young age.
Talk to your doctor.
Learn about hereditary breast and ovarian cancer.
Genetic testing is now available.
Ovarian cancer and fertility.
As noted above, surgery may allow one of the ovaries to be left in place.
It's important to note that even with an ovary present, chemotherapy can sometimes cause ovarian failure, which is permanent.
Before treatment, make sure you take time to talk to your doctor about preserving your fertility before cancer treatment.